Question number 341. After nurse assessed a newborn, she reported that the baby has syndactyly, and the student nurse asked the nurse in charge what is syndactyly. So which of the following is the best nursing response? Option A, fistula. Option B, abnormal big head. Option C, extra finger or toe. And option D, finger or toe wholly or partially united. So option D, finger or toe wholly or partially united is correct answer. Question number 342. A 40-year-old woman patient with Parkinson disease, she stated that she has been experiencing the swallowing difficulty for the past 2 weeks. So the nurse was planning to which type of diet is more suitable for Parkinson patient. So option A, solid, option B, liquid, and option C, semi-liquid, and option D, clear liquid. So option C, semi-liquid is correct answer. Question number 343. A nurse finds a medication error has occurred. So what should be done first? Option A, report to the doctor. Option B, notify the patient. Option C, complete an incident report. And option D, assess the patient. So option D, assess the patient is correct answer, because patient safety is priority after an error. Question number 344. The nurse entered the room as a 3-year-old is having the generalized seizure, and which intervention should the nurse do first? So option A, clear the area of any hazards, and option B, place the child on the side, and option C, restrain the child, and option D, give the prescribed anticonvulsant. So option B, place the child on side is correct answer, because place the child on the side protecting the airway is the top priority in the seizure, and if a child is actively convulsing, so a patent airway and oxygenation must be assured. Question number 345. A client has just returned to the medical surgical unit following the segmental lung resection. So after assessing the client, the first nursing action would be to option A, administer the pain medication. Option B, suction excessive tracheobronchial secretion. Option C, assist the client to turn deep breath and cough. And option D, monitor the oxygen saturation. So option B, suction the excessive tracheobronchial secretion is correct answer, because suctioning the copious tracheobronchial secretion present in the post-thoracic surgery, client maintain an open airway, which is always the priority of nursing intervention. Question number 346. A nurse from the surgical department is reassigned to the pediatric unit. The charge nurse should recognize that the child at the highest risk for cardiac arrest and is the least likely to be assigned to the nurse. Nurse is which child? So option A, congenital cardiac defect. Option B, an acute febrile illness. Option C, prolonged hypoxemia. And option D, severe multiple trauma. So option C, prolonged hypoxemia is correct answer, because most often the cause of the cardiac arrest in the pediatric population is prolonged hypoxemia, and children usually have both the cardiac and respiratory arrest. Question number 347. Which of the following would be the best strategy for the nurse to use when teaching the insulin injection technique to a newly diagnosed client with diabetes? So option A, give the written pre and post test. Option B, ask the question during practice. Option C, allow another diabetic to assist. And option D, observe a written demonstration. So option D, observe a written demonstration is correct answer, since this is the psychomotor skill. So this is the best way to know if the client has learned the proper technique or not. Question number 348. The nurse is assessing the 2-year-old client with the possible diagnosis of congenital heart disease. So which of these is the most likely to be seen with this diagnosis? Option A, the several otitis media episode in the last year. Option B, weight and height in the 10th percentile since birth. Option C, takes the frequent rest period while playing. And option D, changing the food preference and dislike. So option C, takes frequent rest period while playing is correct answer, because children with heart disease tend to have the exercise intolerance. So the child self-limit activity, which is consistent with the manifestation of congestive heart disease in children. Question number 349. Which of the following should the nurse teach the client to avoid when taking the chloropromazine? So option A, direct sunlight. Option B, food containing tyramine. Option C, food fermented with yeast. And option D, canned citrus fruit drinks. So option A, direct sunlight, because phenothiazine increases the sensitivity to the sun and making the client especially susceptible to sunburn. Question number 350. The nurse is caring for the client with the acute pancreatitis. So after the pain management, which intervention should be included in the plan of care? So option A, cough and deep breath every 2 hourly. Option B, place the client in contact isolation. Option C, provide a diet high in protein. And option D, institute the seizure precaution. So option A, cough and deep breath every 2 hourly is correct answer, because the respiratory infection are common because of the fluid in the retroperitoneum, so which pushing up against the diaphragm and causing the shallow respiration. So encourage the client to cough and deep breath every 2 hourly, so which will diminish the occurrence of further complications. Question number 351. A patient is admitted to surgical unit after the removal of foreign body from the trachea through the bronchoscopy. So he is exhausted and is monitored for stability. So what is the most desired outcome of nursing care? So option A, presence of cough reflex and expectorant. Option B, relaxed, pain-free and easily breathing. And option C, optimum oxygen saturation at room air. And option D, increase energy and activity level. So option B, relaxed, pain-free and easily in breathing. Question number 352. Which of the following uses for abdominal examination? Option A, percussion, inspection, auscultation and palpation. Option B, auscultation, percussion, palpation and inspection. Option C, first inspection, auscultation, percussion and palpation. And option D, inspection, palpation, auscultation and percussion. So option C, firstly we'll do the inspection, then auscultation, then percussion and then palpation is correct sequence. Question number 353. A patient diagnosed with OCD continually carries a toothbrush and will brush and floss up to 50 times each day. So the healthcare provider understands that the patient's behavior is an attempt to accomplishment which of the following? Option A, experience pleasure. Option B, relieve anxiety. Option C, avoid social interaction. And option D, promote the oral health. So option B, relieve anxiety is correct answer. Question number 354. The nurse provides discharge instruction to a client after implantation of a permanent pacemaker. So the nurse should tell the client to avoid exposure to which item? Option A, hair dryer. Option B, electric blanket. Option C, electric toothbrush. And option D, airport metal detector. So definitely option D, airport metal detector is correct answer. Question number 355. The nurse is caring for trigeminal neuralgia to assist the client with the nutrition needs. So the nurse should, option A, offer the small meals of the high calorie soft food. Option B, assist the client to sit in a chair for meal. And option C, provide the additional serving of the fruits and raw vegetable. And option D, encourage the client to eat fish, liver and chicken. So option A, offer the small meals of the high calorie soft food is correct answer if the client is losing weight because of the poor appetite due to the severe pain. So assist in selecting the food that are high in calorie and nutrient, so to provide the more nourishment with less chewing. Question number 356. The initial response by the nurse to a delusional client who refuses to eat because of the belief that the food is poisoned. So option A, you think that someone wants to poison you. Option B, why do you think the food is poisoned? And option C, these feelings are the symptom of your illness. And option D, you are safe here, I won't let anyone poison you. So option A, you think that someone wants to poison you is correct answer in case of delusion, because this response acknowledges the perception through a reflective question which present the opportunity for further discussion, clarification of the meaning and experiencing doubt of patient. Question number 357. A client has just been admitted with the portal hypertension. So which nursing diagnosis would be the priority in planning care? So option A, altered nutrition less than body requirement. Option B, potential complication of hemorrhage. Option C, ineffective individual coping. And option D, fluid volume excess. So option B, potential complication of hemorrhage is correct answer, because esophageal varices are dilated and tortuous vessels of the esophagus that are at the high risk for rupture if portal circulation pressure will rise. Question number 358. The nurse teaching the parents of an infant about the introduction of solid food to their baby. So what is the first food they can add to the diet? Option A, vegetable. Option B, cereals. Option C, fruits. And option D, meat. So option B, cereal is correct answer, because it is usually introduced the first because it is a well tolerated, easy to digest and contain iron. Question number 359. When teaching a client with COPD about oxygen by cannula, so the nurse should also instruct the client family to option A, avoid smoking near the client, option B, turn off the oxygen during meal, option C, adjust the liter flow to 10 as needed, and option D, remind the client to keep mouth closed. So option A, avoid smoking near the client. Since oxygen support the combustion, so there is a risk of fire if anyone smoke near the oxygen equipment. Question number 360. A client continually repeat the phrases that other have just said. So the nurse recognize this behavior is option A, autistic, option B, echopraxic, option C, echolalia, and option D, catatonia. So option C, echolalia is correct answer. Thank you.